Thanks for joining us today, everyone. Again, in the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. We do not have any officials joining us over the phone line today. Both the Premier and the Doctor will have opening remarks, then we'll have time for questions.
Well, thank you very much, and thank you everyone for joining here today, and good afternoon. I want to begin by saying thank you to everyone in Saskatchewan for everything that they have done to reduce the spread of COVID-19, in particular, everything that they have done over the last month or so. Going into the start of August, Saskatchewan had over 300 active cases, the highest numbers of active cases that we have seen in this province to date. As we enter September today, we are down to only 29 active cases. It's one of the lowest numbers of active cases that we have seen since the pandemic first hit this province back in March. So once again, I want to say thank you to each and every one in the province. We now have a very low number of active cases in our Hutterite communities. So I want to take this opportunity to thank everyone, each and every one in those communities, the community leaders, the Huttarian Safety Council, for your cooperation and for your efforts over the past several weeks. Those efforts have worked. Your communities are now safer. And so thank you to each and every one in Saskatchewan's Hutterite community, a number of whom I count among my very good friends. We're in a very good spot in this province as we head into fall, as we head indoors more, as our children head back to school. And this is a good time for each of us to reassess and to reevaluate our daily routine. This includes how we physically distance. This includes our daily routine of hand washing and the use of sanitizers, carrying a mask and ensuring that we are using that mask when appropriate, reassessing our contact circles and keeping them as small as possible, because we know how quickly things can change if we let our guard down just for a moment. We've seen that in other provinces recently. We've seen that in our own province at different times since March. So today, I once again ask everyone in Saskatchewan to be even more careful and vigilant as we head into this fall season. Right now, our community spread is very low. Let's do everything that we can to keep it that way. The best way for us to keep COVID-19 out of our schools is to keep COVID-19 out of our communities, or at least to keep the spread of COVID-19 as low as possible in our communities, and that we are doing today. This includes being in particularly and especially careful if you travel outside of the province. Right now, our neighbors to the east and west, they're seeing some rising case numbers. And I expect them to get that under control soon. But for now, if you don't have to travel to another province, please don't. If you absolutely do have to travel outside of Saskatchewan, we would urge you to try to limit the number of personal contacts that you would meet. Follow, of course, all of the good practices that we have repeatedly mentioned around physical distancing, your hand washing, and potential mask usage, and appropriate mask usage. Follow all the local public health orders wherever you are, and when you return to Saskatchewan, you should self-monitor for symptoms and consider getting tested, as testing is now open to everyone. As we know, this virus does not move by itself. People move it from one place to another. So let's all try to avoid bringing it into Saskatchewan from various locations outside of our province. It's how we'll keep ourselves, how we'll keep our families and our communities, as well as our schools, safer. I also want to thank all of the school divisions who have done a very good job in preparing the detailed plans for their individual schools, and then getting those plans out to parents. I want to thank the teachers and other staff who are spending this week getting their schools ready for their students to return after Labor Day. Like everything else this year, school is going to be a little bit different. It's going to be different this fall for our educators, our teachers, as well as different for our students and for our parents. But I know the kids are looking forward to getting back to school, and I know the teachers are looking forward to getting back to teaching. With each of us doing our part, I am very confident that we can reopen our schools safely and have another successful school year ahead of us. So, Dr. Shahab?
So just a few points. I'll go in a bit more detail. So as we have seen over the last week or so, our daily numbers have been extremely low. Our effective reproductive number is now around 0.5 and is well under 1 throughout the province. So I think that's a big achievement for everyone in Saskatchewan, that we have seen occasional increase in cases in different parts of the province. But right now we are in a really good position for the restart of schools next week. And again, if we were to see a case or a cluster in a school, as has been reported in other jurisdictions and other parts of the world, we laid out the approach that we'll take. Public health is working on a daily basis with schools and school divisions, and we're fully prepared to work with schools to manage the occasional case or cluster if we were to see one. Schools have put in a layered approach. And the best method for reducing COVID in schools remains staying home and seeking testing, irrespective of whether you're a student, a household member with a student in school, a staff member or teacher, or a household with a staff member or teacher working in a school. I think that has remained our mainstay of making sure that we isolate both as cases and contacts and prevent further transmission. Teachers are a priority group for testing, and all staff and students are encouraged to self-monitor, and parents to monitor their children and stay home and seek testing throughout the coming weeks. This is not just before school start, but throughout the next few weeks and months. Self-monitor and seek testing. That is going to be really important, and of course that will increase the number of times a child has to stay home. But that is something that all of us have had to become used to as we've re-entered the workforce, and we'll have to accommodate that for students and staff in schools as well. And then finally, I just want to say that it's what we have heard from both schools and parents is that many parents are looking forward to for children going back to school. Many children are looking forward. We all realize the positive impact schools have for not just education but physical, mental, and social development. And I think while schools have done a great job to make it safe, I think they are also making sure that even though things are a bit different, but it's a welcoming place for students going back to school. And I wish everyone a great back to school week next week. Thank you.
Thank you, Premier. Thank you, Doctor. We now have time for questions. Arthur?
So today we're hearing a reiterated recommendation against interprovincial travel, but yet at the same time there's a number of billboards in downtown Regina that are advertising to Saskatchewan people to come find your heart in Manitoba. And I was just wondering if you think that sends a mixed message, and whether you think it's appropriate for Tourism Manitoba to be advertising that way.
Well, listen, when those billboards were booked, things may have been different with respect to the numbers we see, and the numbers fluctuate very quickly, and we've seen that in this province, where we have had localized outbreaks in groupings of communities or in communities. We had the first one in La Loche. We had an outbreak in a number of our Hutterite colonies spread across the province, which we seem to be in a much better spot on today. But the tourism industry, again, as we try to reopen and attempt to reopen, the broader economy across not just Saskatchewan but Canada, the tourism industry is one that has been hit very hard. That is reflected not only in tourism operators, and we're seeing some of the economic challenges are starting to arise there, but as well as the methods in which people get to other places to tour. Airline companies, for example, have bared the brunt of the consequences of this pandemic. So, I don't discount anyone for trying to advance their particular industry. If there's billboards, I haven't seen those billboards downtown Saskatoon. What we're recommending is, if it is not absolutely necessary to leave the province at this point in time, and this isn't at any point in time, it's at this point in time, we see numbers that are rising in some of our neighboring provinces, and so if it isn't absolutely necessary to leave, you should reconsider and maybe stay put at home here. If you do have to leave, and here's the question: is if you do leave the province of Saskatchewan, are you automatically going to get COVID? Well, of course not. Will it increase your chances of getting COVID given the current environment that we're in? It may. And so we just asking people that if you do have to leave, just be very, very vigilant in ensuring that you are keeping your contact circle as small as possible, abiding by all of the recommendations that are in place. Again, this is not a sprint. This is a marathon. We have had multiple outbreaks in this province. We've seen outbreaks in other provinces as well, and this is going to go on for a number of months. And so I do not like using the term the new normal, but things have changed. Most certainly things have changed here.
Follow up, Arthur?
There's a memo that just went out, I think yesterday, through the SHA to its employees that speaks about the risks of the back to school plan and how it could have an impact on their staffing as more healthcare workers have to stay home because of their children. And I was wondering how concerned both of you are about that eventuality and what, as far as you know, the health system is doing to prepare for that.
So I would say I haven't seen the memo. We're concerned with all sectors of our economy that there's a chance for exposure to COVID-19 and the resulting consequence of having to self-monitor or ultimately potentially having to get tested and actually self-isolate. So that isn't in any way isolated to the healthcare sector or the education sector. Those, those concerns have been there for, our frontline people that are working in our grocery stores throughout this pandemic, and in various other industries that have been, operating throughout this pandemic. We must not forget that throughout the pandemic in Saskatchewan, 87% of the workforce continued to work. Now, some of that was very different, some was at home, but much of that was in their place of business doing things in a very different way. So the concern, we share the concern. I haven't seen the memo. I'd share the concern in the health sector that has been open throughout this. I share the concern in the education sector, but I share the concern with the broader population of the province that has, and many of which have been going to their place of employment throughout the response to this pandemic. This is us doing things differently. We've done them differently now for some time in our healthcare sector, and we're going to do them differently starting next week in our education sector. And that, I think, matches with every other sector that has been open thus far. But you might have a little more detailed information, Doctor.
Yeah, I think I'll just like to add that, our test positivity rate in March, April was around less than 2%. Right now it's 0.3%. And what that means is that even if you have a sore throat or cold or a fever, it's very unlikely to be COVID. It's more likely to be another respiratory infection. But having said that, this is the year where you don't go to work or school sick. And I think what that means for the SHA employees is that for employees who have kids in school, it is disruptive if a child suddenly wakes up and has a sore throat, where ordinarily the child could have slipped into school, but this is not the year for that. And that extra layer of precaution is going to be very important. And obviously, all of us with children in school need to make adjustments so that if a child has to stay home and is not yet, old enough to be at home alone, what's your backup plan as a household? Or as a virtual household bubble, can you rely on others? But I think, I've said in the past also that, on average a child gets, 4 to 6 coughs and colds a year. And this is the year when a child will stay home till that cough or cold settles and should, if it's significant, get tested. And I think that's something all of us need to accommodate as employers, as employees, and as parents of children in school, and also as staff who work in schools, because it's just something that we just need to be aware of.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
Hi. My first question is regarding the active cases in Regina. The release today said there are no active cases, but we know that a person at the refinery has tested positive. So just wondering if you're able to say where that person comes from, which zone, and is it a concern that there is a case at the refinery?
So we don't usually talk about individual case investigations, but I'll make a couple of general comments. So, it's true that active cases in Regina are very low, and when I looked at the numbers, I saw one, but we can check whether there's some inconsistency. But I think what that shows is that we had a bit of an increase in the Regina area. There's an outbreak in another workplace, not the refinery, a few weeks ago. But over time, in 2 weeks or so, cases recover. So it's important to recognize that if you see a bit of a rise, ultimately they do go down. Because in that particular instance, the outbreak was managed very effectively by the company and with the systems of public health. And secondly, we have seen occasional cases and clusters in large work sites, whether it's a refinery or whether it's people who work in northern Alberta from Saskatchewan. Thankfully, we haven't had those large outbreaks in Saskatchewan, and my understanding is that public health has been working closely with the co-op refinery in Regina and trying to get ahead through isolating, obviously, the case, close contacts, offering enhanced testing, making sure that their occupational health and safety practices promote, all the things we mentioned that we should be doing all the time, hand hygiene, and not working if you're unwell, mask use where appropriate. So we'll monitor closely. It does sometimes take a while to ensure that there isn't an outbreak in large workplaces, but certainly we're confident that, working with public health, a large workplace like the refinery will be able to manage that if there were to be further cases.
Follow up, Lisa?
Yes, this question is for Premier Moe. We know that there is, a shortage of lab techs in Saskatchewan, and they need more to be able to reach that higher capacity that you guys want, the 4,000 for the fall. There was a release earlier this week that you've increased spots in the lab tech program at Sask Poly, but that's a 2-year program. That's not really going to see any effects for a while. This is an immediate problem. So what's being done right now to get more lab techs into these labs?
So they are, you're right, with respect to the announcement at Sask Poly with increasing the number of spots, that is more of a long-term solution to a shortage of lab techs that we have felt it will arrive here in the province. So that is separate, essentially. It's somewhat related, I guess, but separate for the most part from the decision that we have had to temporarily ramp up some of our testing and contact tracing staff within the Saskatchewan Health Authority. Where they're not able to procure lab techs to do that work on a temporary basis, they're looking at what other disciplines they could procure, and it's my understanding that there are some other disciplines that can do some of that work. There is some that is doing some of the testing in the Roy Romano Provincial Lab, and so they're, what we are trying to do is to use every opportunity that we have to increase our testing capacity here in the province. We are at a capacity today where we can achieve 3,000 tests in short order. We'll be able to achieve 4,000 tests if it's required. And that doesn't mean that we'll ever get to that number or we'll have to perform that number of tests in a day. But we feel it's prudent to ensure that we have that degree of capacity should we need it. And to ensure the safety of Saskatchewan residents as we move forward.
We'll take our next question from the room. Steph?
Yeah, to the Premier. Why not introduce a mandatory 2-week self-isolation period for people coming back into Saskatchewan from certain provinces if you actually want to restrict them leaving and possibly kind of bringing the virus back?
One, our economies are very, very integrated. In fact, we have cities that are very, very integrated and share the border between, in this case, Saskatchewan and Alberta. We have people that are traveling back and forth between Saskatchewan and Alberta daily for work, Saskatchewan and Manitoba as well, daily for work, or on a weekly or bi-weekly basis. So we are very integrated across our provincial borders. There's even people that work beyond those two provinces on a shift basis. So there is there is a reason that people do travel back and forth. But what we are recommending today is if you absolutely do not have to travel, you should rethink that. We would recommend that you don't if it's not necessary. We would recommend that you do stay at home. And if it is necessary that you travel, we are asking you to just pay very close attention to your contact circle, pay close attention to the public health recommendations that are in place. And when you do return, you should self-monitor, not self-isolate necessarily, but stay aware of your contact circle and keeping it small, but most certainly self-monitor for any symptoms of COVID-19.
Follow up, Steph?
Yeah, it seems to me though, when these restrictions have come down in other forms, there's been exemptions for essential travel like work, because I do understand there are certain jobs that depend on people moving. But in a case like this, like what do you consider, non-essential travel, and why not bring in some kind of rule for a 2-week self-isolation rule with exemptions for, say, truckers or manufacturing or something, just to try and actually put some teeth to this ask?
Well, the goal is not to put teeth to the ask. The goal is to flatten the curve and stop the spread of COVID-19. And to date, this recommendation comes from our chief medical health officer. But to date, the people in this province have followed the recommendations very, very well. And when the recommendation is put out to, you think twice about your interprovincial travel. There are some numbers that are increasing in some of our neighbors to the east and west of us. It isn't that long ago that it was our numbers that were increasing. Thankfully, we have gotten into a much better place with respect to the active cases and the spread in Saskatchewan. It's our expectation that our neighbors will, in short order as well, or in a reasonable time frame. But for this specific period of time, what we are just cautioning the people of this province is to think twice before you are doing any unnecessary travel outside of the province. And if you do have to travel, we've put some recommendations around that. We're not yet at a point where we are saying that you would have to self-isolate for 14 days upon your return. We did that very early on international travel, and then that was superseded by the federal order on international travel. But to date, throughout our response to COVID, we have not put isolation restrictions in place on interprovincial travel.
And we'll take our next question from the phone line.
We have Morgan Majeski with CBC.
Thanks so much. So why hasn't the government of Saskatchewan signed up for the federal government's COVID-19 tracking app? We're seeing more people kind of wanting access to the app, wanting to use it. What is the holdup or the hesitation to kind of sign up for the federal COVID-19 tracking app here in Saskatchewan?
So it's more of an alert app, a COVID alert app, as opposed to a tracking app. The app actually does not track anyone. It does send out an alert if you have been in contact with someone else's phone who the owner has been identified as having COVID. So this app, the work on this app actually began in Ontario under Premier Ford's government. The federal government, through our Council of Federation calls, has adopted a lot of that work and brought this COVID alert app, brought the potential to have it available across Canada. So all of the provinces, aside from Ontario, that was working on this earlier, all of the provinces now are working with the federal government on whether or not, A, they're going to make it available in their provincial or territorial jurisdiction, and B, when exactly and under what parameters that would be. So there's a little bit of consultation that is going on within the Saskatchewan Health Authority, but I could say that Saskatchewan is going to be moving ahead with making this app available. We had consultations and briefings with the minister as recently as a couple of hours ago. So we will be moving forward with this. We hope to have it available for those that choose here in Saskatchewan over the course of the next couple of weeks. And it will again be one additional tool that will be available for the people of this province to ensure that we are flattening the curve and continuing to reduce the spread of COVID-19.
Follow up, Morgan?
Yeah, kind of changing gears a little bit here. We have received a tip that the Saskatchewan Health Authority Public Health was not informed of the new public health measures for school, things around contact tracing and the testing plan, prior to the Ministry of Health announcing it publicly. So were those who need to carry out the measures, didn't they not know that this was coming? And if you could confirm this, why wasn't public health consulted and informed, on this plan before it was publicly made available?
So yeah, no, so I think this is a large sector, and from my side, I think I connect with my counterparts several times a week, and then we also connect within government with the Ministry of Education. The Ministry of Education obviously connects with the 27 school divisions, and then the school divisions connect with all the schools in their area, geographical areas. So I think it's a large sector that's opening. I think we make sure that once processes are finalized, everyone gets a heads up once websites are updated. But sometimes there can be a delay in terms of, for example, there's a parent package that when final edits are made, sometimes it's put online or sent out in a way that some people get it before others. So obviously, we need to continuously improve those communications. But certainly, this is an area where for the last several weeks, public health throughout the province has been engaged with local school divisions. But it's a very large system in terms of the communications. Ultimately, is now going out not just to the communications are going out not just to. Sorry, I think that's my alarm for. The communications are going out not just to local public health staff and health staff, but also to parents. So, sometimes there can be a bit of a delay in terms of the final packages going out to everyone at the front line, and we obviously need to improve that. But I think we continue to work in a very collaborative fashion, not just at a provincial level, but also at a local level. And a lot of the ongoing planning is happening, at a local level to adjust the processes as schools reopen. As we know, there's 4 levels for reopening, but for every local jurisdiction, looking at the active case numbers at the smaller geographies, there's always a bit of adjustment that's happening right now. It's been happening for the last 2 weeks, and that will continue to happen. There'll be local adjustments to the plans and the processes depending on local conditions, and I think that is going to be key to a way of managing school reopening in a way that adjusts not just to the overall plan, but adjusts to local community transmission.
On the just the dissemination of information and I think all of ours our need to try to find as much information so that we can provide so that we can have as much certainty as possible. And the education response team and public health have been working very hard as we, and I don't know the specifics of exactly what you're talking about, but at a higher level, the education response team has been working very close with public health, meeting on a weekly basis now as we reopen our schools and implement our operational plans. And as this communication of information comes. In collaboration with public health, the education response team, their school divisions, and then is disseminated out to each of the individual boards, to our educators, our teachers within each of our individual schools, and then ultimately to our parents of the children that are the ones that are making the decisions in how education is going to look for their children and our students this year. We have worked together with the education sector, our stakeholders throughout the education sector, partners, I would say, throughout the education sector and public health, on put together a strong plan. It's an adaptable plan. It's based on 8 principles. It has 4 levels of operation, and now we have our divisional operational plans in place that go down to the very granular level of each individual school. And I was out this past week and talked to a number of teachers across the northern parts of the Forest Fringe in this province, and they are excited to get back into school. And there is going to be some tweaking as we get through the first number of weeks, but they are getting their classrooms ready, and I thank them for the efforts that they are making in implementing their divisional plans, their operational plans, and I thank them in advance for, I know, the continued efforts that they are going to make to ensure that those classrooms are as safe as possible. This is a fluid plan. It's a plan that is built to move as we go through this process and the environment changes. And as we all do what we need to, I know that we'll find success with the plan that we have before us. And it's because of the people that are involved.
We'll take our next question from the room. Morgan, do you have a question?
Hi. To Dr. Shahab, I was wondering if you could speak to the importance of testing in general, especially as we return back to school. I know Saskatchewan is below the national per capita rates in terms of testing, and if you could speak to people generally about the importance of keeping those testing rates high so that if there's asymptomatic spread, or if we have an idea of the real numbers.
Yeah. So I think regarding testing in general, I think we have done well in terms of testing is available to anyone in Saskatchewan, whether you're symptomatic or asymptomatic. What's worked extremely well for us is that if you have any symptoms that could be COVID, you should seek testing, and that's widely available. And as it relates to back to school, like I mentioned, it doesn't matter if you are not in school, but if you are within a household that you have children going to school, or you have a household member who teaches in a school, even then it's important for you to get tested, because even if you are not going to school, but you're in a household with a child or person going to school, if you get tested, if it's negative, everyone is relaxed. But if you are positive, then all your household contacts have to stay home, even if they work in school or their children. And I think that principle has worked so well for us in Saskatchewan, and this is the main principle we should apply in terms of back to school. But having said that, teachers are a priority, and we've seen in the past that if there's COVID in the community, that's more likely to then result in COVID in a school setting from other jurisdictions that, by the way, started school at much higher transmission rates that we are at now. But having said that, for teachers who have any concerns, and we applied the same principles for healthcare, other essential workers once they started working, if you have any concerns and want to get tested, get tested. And if it's negative, it's reassurance. And throughout the coming weeks and months, get tested at the slightest sign of symptoms, get tested if you have any concerns. That's worked well for us as many sectors have entered the workforce, re-entered the workforce, and I think that is going to be a guiding principle. And finally, testing capacity is sufficient to meet any anticipated surge. And if it goes down like it's gone down a bit over the last day or two, that's fine. But if it goes up to higher than 2,000 a day or even higher, there's sufficient testing capacity to meet any demand.
I know you had. Oh, sorry.
No, follow, go ahead.
I know there had been mention of implementing drive-through testing sites in Regina and Saskatoon. Do we have any sort of a timeline as to when we might get more information about that?
I think there will be some announcements coming over the next few days, but that is certainly another way of making it easy to access testing, especially in the larger urban centers. But even then, teachers are already a priority, and if any person wants to get tested, and especially if you work in a school setting, if you call 811 and mention your occupation, it's easy to get testing irrespective of whether you're in a school, but if you mention that you teach in a school, that is on the priority list. But again, right now, because testing capacity is high and can meet any demand, everyone can get easy access to testing. Usually testing results are reported within 24 hours, and positive test results, negative can take up to 2 to 3 days, but access is easy and will continue to improve.
Two points there on testing that I would just make a comment on. One is capacity, and two is the accessibility of the testing that we have. And so I would just first start with the capacity, and we've discussed where we've been, where we're going with our numbers. And I would just say that there has not been a single day where our demand has outstripped our capacity to test here in the province, and we don't foresee that in the future, and that's why we're planning to continue to increase our testing capacity as we have the last a number of days up to and including a capacity of 4,000 tests. The second then is accessibility to your second question on drive-through testing in particular in Saskatoon and Regina. There's some finalized decisions that are being made on that. I just got a briefing from the minister before we came in. There's some finalized decisions being made on some locations on the Saskatoon and Regina, the specific locations today, that hope to announce those locations by potentially the end of this week. There will be some additional locations around the province to follow. And then also with our testing within our schools, we're anticipating that will be made available by the second week of school. So that would be, I guess, the third week of September. We're hoping to have some of our mobile units that will be moving into specific schools to provide some testing where public health and education feel that it may be necessary to do some randomized testing. So the waivers in those particular school divisions, those particular schools should be available by next week when the students do return to school, and followed by the week after with some randomized testing. So drive-through testing should have some further clarification as hopefully by the end of the week, and then some of our school-based testing will be up, and we're hoping it will be operational the second week of the school year.
We'll take our next question on the phone line.
We have Jean-Baptiste Demoy with Radio Canada.
Oui, hi, hello, can you hear me?
We got you, John.
Yes. So my first question would be, when the economic update was announced last week, it was criticized by the opposition, also because there are still a lot of people at risk of losing their job by the end of the year. It was, according to Trent Waterspoon, around 24,000 people. So I was wondering what was your message to the people at risk of losing their job?
Well, you know, this is, unless you want to answer this, Doctor? No? You know, this has been our concern since day one is, well, first and foremost, our concern has been the safety, the health and safety of the people of the province. And we have made what we feel all along the very best decisions that we can make, given the information that we have at the time, to ensure that we are keeping people in this province as safe as possible and reducing the load on our healthcare system so that we can still have a healthcare system that operates for all of the other services that we need that system for. So second to that health and safety of the people in this province and reducing the load in our hospitals has been, how do we have the minimal impact on our economy, and how to the degree that impact is there, and it has been there in virtually every economy across the world, including the global economy, how do we mitigate that as quickly as possible? How do we support those that are being impacted, and then how do we mitigate the length of that impact and ensure that we are providing every opportunity for people to get back to work as soon as possible? So first and foremost, I think it's important for us to note that of the people working in this province, we were able to, on a per capita basis or percentage basis, allow the largest number of people to remain at work throughout our response to the COVID-19 pandemic. 87% of the people in the province were able to remain working in some way, shape, or form, much of it very different, admittedly, than pre-pandemic conditions. That led the nation in the degree of our workforce that was able to continue working throughout. So we shut down less of our economy than anywhere else in Canada. In saying that, we were among the very first to start to reopen those sectors of our economy, and we're familiar with our stages of our Reopen Saskatchewan plan and how we walk through those stages right in this very room over the number of weeks throughout this summer. That being said, there's still you know, much work for us to do. But it's also important for us to realize that this virus is still present. So as we move forward, and we've been meeting with industries as recently as this week on how can we ensure, A, that we are able to recover to pre-pandemic levels as soon as possible, and B, how are we best positioned in this province within the industries that are our source wealth creators? How are we best positioned to ensure that we can then grow from those pre-pandemic levels, get back to the growth plan that we had released a little over a year ago? Those targets still are still the targets for the province of Saskatchewan. Now we have to do things a little differently in the short term, but most certainly we are working very closely with industries to make every effort that we can to put Saskatchewan industries in a good place to recover, a good place to grow, and a good place for us to ensure that each and every one of those people that are not working today will be able to go back to work in the days ahead. Essentially, this is the question that is going to become before the people of the province in the very near future: is who is best to recover the economy in Saskatchewan?
Follow-up, Jean?
Yes, thank you very much. So we all know that there's a real spike in overdoses in Saskatchewan. So I was wondering, what would the government do to help curb this recent spike?
Right, and you know, these are, you know, very disturbing numbers. I look at the coroner's numbers the other day that were reported on, and they are up from last year. And this is not only a problem that is, or a challenge that is unique to Saskatchewan. This is a challenge that I think we are dealing with at the provincial level and the federal level, right across Canada. You know, I think of some comments that the chief coroner had made in an article that I read the other day, when what is actually driving the spike is the deadly opioid and fentanyl, as well as some of the derivatives that are being made available to people in our communities. So we are dealing here with illegal substances that people are using, and the recent number of overdoses that we have in Saskatchewan and more broadly across Canada are a concern to all leaders. And we have invested heavily in this area over the course of the last number of years, in particular over the course of the last year or two, increasing our investment into the mental health and addictions and our support services, in particular in addictions and overdose support. Heavily, as I said, in particular over the last 2 years, I think $33 million just in this past year's budget to a total of $435 million that have been supplied across the province this past year. Now, that's just a number, and we are working with our delivery agents to ensure that number can actually be turned into some degree of outcomes in our communities in supporting our family members that are all too often unfortunately involved with these illegal drugs that are being made available in our communities. The other approach that we have had in addition to supporting those with addictions issues is ensuring that some of the essentially life-saving treatments are available and available readily. And I'm thinking of the naloxone kits that we have provided to many in our communities that are in the vicinity of where an overdose may take place, as well as providing them now into a number of pharmacies across the province, and most recently expanding that number of pharmacies that have access to naloxone kits, and actively in discussions on lowering or eliminating the cost of those naloxone kits to ultimately make them available to to the people that may need them or may be witness to ultimately an overdose. So these are concerning statistics. I'm not going to say any different. We have been investing heavily. We have been focusing on outcomes. We have been sharing best practices with other provinces, and we will continue to do all of that as we wage what is ultimately a real battle across this nation, the battle of access to illegal substances that are directly harmful to the people that family members and people in our communities, people that ultimately we love very much.
We'll take our last question in the room. Arthur?
So again, on the issue of travel between provinces, as I understand it, there used to be a flag in the SHA's screening policy where they would ask people if they had traveled between provinces, and it would cause a flag if they said that they had. It was removed some time ago, and as I understand it, hasn't been put back into place. If it sounds like this is now one of the major concerns for us, given how low case rates are here in the province and how high they are in Alberta and Manitoba, why don't we put that back into place to ensure that people that have traveled interprovincially aren't coming into our health facilities?
You want to answer that?
I can certainly confirm that, but certainly taking a travel history either within the province or outside the province is a standard part of assessing and triaging in terms of symptoms. But I agree that generally right now the emphasis is on international travel, and obviously we were in a situation where comparatively our rates are not so much lower than other provinces. But I would agree that I think they should be flagged not just for interprovincial travel, but also for your activities the last 2 weeks, because some people may live in one province and just travel back and forth across the provincial boundary. They're not at any high risk. And some may travel to visit a friend or a relative, and they would be at low risk. But obviously, when you go on vacation, you in some cases may behave a bit differently, irrespective of whether you travel within the province or outside the province. And obviously, it's really important to see where you're traveling. Is that a hotspot? And maybe look at your plans and not go to a hotspot, because that level of detail is available through the media or through provincial websites. Choose another location. But at the same time, even if you're traveling within the province or outside to an area that is not reporting a high number of cases, I think you still need to be mindful in terms of how big is your group, what are you doing, and just that, being a bit having that awareness about maintaining all the good practices that we've been maintaining about, getting closer than 2 meters only within our virtual bubble or our close contacts, and otherwise maintaining that physical distancing. But I think that's an important point, and we can certainly look at, if there was a flag. It may have been mostly in the intake and ER, but certainly as part of routine clinical assessment travel and activities in the past 2 weeks are important, as well as your current symptoms, because that's another thing that all patients should always declare their current symptoms before they seek healthcare, so that all precautions can be taken. And if they have concerns that they may have been in situations where the risk of exposure to COVID or other communicable diseases may be high, that's worth mentioning as well.
I would just say, I believe that people that had traveled, one of the screening questions was to screen them for the potential of a test. Where now we have open testing up to anyone that can call in would be available to have a test. So that's one change that has happened since that point in time. What we are recommending people here today is if you do return from some necessary travel outside of the province, please, while you're away, adhere to all of the public health recommendations. But self-monitor when you return, and don't hesitate. If you feel that you want or feel that you should be tested, don't hesitate to call 811. That is why we are pushing to have the testing capacity available, so that people that may have traveled, may have suspicions about or symptoms, that just phone, have a test, and it will put you at ease if that's what you choose. We've opened the one significant change then was a screening tool on whether you'd be recommended for a test. Today you can call in and testing is available to everyone, and that's why it's so important for us to expand the capacity like we have over the course of the last month.
Follow-up, Arthur?
Yeah, follow-up. This is for the Premier. We've been in stage 4.2 of the reopen plan for some time now, and with cases as low as they are, is any consideration being given to entering stage 5 and maybe rethinking some of the remaining long-term restrictions?
So you might want to add to this as well, Doctor, but I would say as a blanket entry into stage 5, and not a lot of consideration being given to that, which is essentially mass gatherings. And in saying that, there are some, not mass gatherings, but some events where organizations have reached out, have been working with our public health office, Dr. Shahab and his team, on is there a way for this to ultimately be above our 30-person limits, but is there a way in these types of venues to safely have some type of event. I'm thinking of some of the discussions around some of our gate-driven leagues. The SJHL, some of our the WHL even. There was much discussion around how would a CFL operate if it was to operate. So there has been some of those discussions specific to different venues, different events. But as far as moving into essentially a mass level 5, let's have large events again. There's no discussion about that at this point in time. If you have anything to add to that, Doctor?
Yeah, I think what I'd like to say is, and I'm just looking at our phase 5 things, that I think one thing that we need to remember is that as long as, up till such time that there's an effective vaccine, for example, what we absolutely must do is maintain the precautions for the most vulnerable, so persons in long-term care facilities, personal care homes. I think that's essential. But having said that, we have seen that visitation policies have been relaxed. Outdoor visitations are allowed where possible. So but it has been done under a situation where there's low community transmission, and we've also seen that when community transmission increases, sometimes those more relaxed visitation policies get tightened up a bit. So I think that is something that we must absolutely continue with, protecting the most vulnerable. I think we all want to see how, given that we have low transmission rates, I think the next few weeks are really important to support a safe reopening of schools, because that is a large sector in terms of number of people going back to school and in terms of students and staff. So I think that's a key priority over the next few weeks. But having said that, we obviously need to look at, so we have static seating for 150 people at events, variety of events. We've done really well in Saskatchewan that we haven't had large outbreaks when people go to places of worship and other settings. And what I've heard is that we do see occasional cases or clusters, but people have been very diligent with all the good practices, not going if you're unwell, maintaining that physical distance between households, quick contact tracing, because places of worship have lists of people who have gone. And all of that has helped us to prevent large outbreaks in those settings, which we've heard from other jurisdictions. And then certainly additional layers, such as a tracking app, can further help, because if you have larger gatherings, if you can cohort them into groups of 30 or 150, and where you don't mingle between groups, I think those principles are going to be key going forwards if there's opportunities to further look at opportunities in phase 5. But again, I would agree that I think we need to consolidate where we are, support, school reopening. I think as the weather changes, we move indoors, relook at our practices, including more consistent mask use in indoor public spaces. And once we can reevaluate where we are in a few weeks, I think certainly we should look at other opportunities, but in a way that promotes, an approach that prevents uncontrolled transmission. So, thanks.
And that concludes our time for today. Thanks for joining us, everyone.